Good morning, everyone. My name is Jeremy Jen, and today I'm presenting comparing weight loss outcomes after conversion to Roux-en-Y gastric bypass versus the duodenal switch from sleeve gastrectomy in a community hospital. I have no financial disclosures. I will keep it up for 7 seconds. So we know that bariatric surgery has been increasing in the United States. Currently, laparoscopic sleeve gastrectomy is the most common procedure, upwards of 58 to 60%. However, there is a high rate of recidivism after initial bariatric surgery, some reports as high as 30-some%. This is reflected in consistent increase in revisional bariatric procedures, now up to 16 to 17%. What we know currently from research in revisional bariatric procedures is that they have less weight loss compared to initial bariatric procedures. We know that among initial bariatric procedures, the duodenal switch is the procedure that has the highest weight loss and the most resolution of metabolic disease compared to Roux-en-Y gastric bypass and then followed by sleeve gastrectomy. There's little research directly comparing revisional surgery, such as from sleeve to bypass versus sleeve to duodenal switch. So for our study, it was a single institution retrospective study. We had 2 bariatric surgeons who performed the same operative technique for both Roux-en-Y gastric bypass and duodenal switch revisional surgeries. The patients all had the same perioperative care. The patients were enrolled from May 2015 to August of 2021. Revisional Roux-en-Y gastric bypass patients were enrolled starting May 2015, while the duodenal switch ones were enrolled later, starting in April 2018. 75 patients were enrolled, with 40 for the Roux-en-Y gastric bypass and 35 for the duodenal switch. So for our technique, we used laparoscopic technique. None of the patients had to be converted to open. For Roux-en-Y gastric bypass, we had a Roux limb made that was 150 centimeters, while the BP limb was 80 centimeters. The pouch was created by inflating a 30 cc balloon. For the duodenal switch, the common channel was 150 centimeters, and the Roux limb was 200. Our primary outcome was mean excess body weight loss at 3, 6, 12, and 24 months. We compared between the 2 groups. We also compared within each subgroup for individual patients over time to see if they had significant weight loss over these time periods. Secondary outcomes were length of stay, length of procedure, and 30-day readmission rate. For our results, this, as you can see from the graph, at 3 months, Roux-en-Y gastric bypass patients had more excess body weight loss compared to the duodenal switch, 24 to 18.8%. This is reflected, and this trend is continued in month 6. But at month 12, the duodenal switch caught up with them being virtually the same. And at 24 months, the Roux-en-Y gastric bypass had plateaued with some recidivism while the duodenal switch continued to lose weight. This table are the numbers from the previous graph. What's of note is that there's a statistical significant difference at 3 months between the 2 groups, while afterwards there's no statistical significance at 6, 12, and 24 months. You can also see the numbers for the patients in terms of patient follow-up. This table shows the comparison between the 2 groups within each subgroup. So you can see for both groups from 3 to 6 and 6 to 12 months, there's statistically significant weight loss. However, from months 12 to 24, there is no statistical significance, but you can see the trends. Roux-en-Y gastric bypass had some weight gain, while the duodenal switch continued to lose weight. And these are our secondary outcomes. There's statistical significant difference in procedural length, with the duodenal switch taking on average 55 more minutes, but this did not reflect length of stay or 30-day readmission rate. However, there is a trend of 30-day readmission rate of the Roux-en-Y gastric bypass having greater amounts of readmission. So in our discussion, there is statistical significant difference between the two groups at 3 months, while there's none afterwards. One possible reason this may be the case is that our Roux-en-Y gastric bypass patients were both restrictive and malabsorptive in terms of modifying the gastric pouch. We did not re-sleeve our duodenal switches, so they were purely malabsorptive, and so therefore this may have caused the bypass patients to be eating less initially and cause a greater weight loss at 3 months. However, because the duodenal switch has a shorter channel length, common channel length, so therefore their greater malabsorptive effect seems to have caught on, so afterwards there's no statistical significance. We also saw subgroup weight loss that was statistically significant up to 12 months. This shows that the revisional surgery is effective at causing weight loss. Length of operation was also different. Likely this is due to a learning curve as we started duodenal switches at our hospital in 2018, and so this number is likely going to come down over time. Trends, the duodenal switch had continued weight loss up to 2 years, while the Roux-en-Y gastric bypass had some plateau with some amount of recidivism at 2 years. Again, this may be due to the greater malabsorptive effect of the duodenal switch. It may also be that our study is not high-powered enough, and that further study would show that there's no statistical significance. There's also the 30-day readmission rate trend that may be due to the fact that the bypass, we modify the stomach, so there may have been more symptoms. What's not statistically significant is length of stay, as well as no difference at 6, 12, and 24 months. Advantages of our study, it is single institution, and so therefore we have the same operative technique, same perioperative care, minimizing variables between any institutions. The limitations of our study, it is retrospective in nature. We are not able to randomize to each different group, and this was compounded by the fact that we are limited by patient comorbidities. Patients with large amount of reflux, we had to preferentially place in the duodenal switch, and those with a strong smoking history, because of the risk of marginal ulcers, we had to, it's the other way around. Those with reflux, we had to preferentially place in the bypass group, while those with strong smoking history had to be placed in the duodenal switch group. Our duration was also only 2 years. For this study, we did not investigate longer, so that may be limited. And our power is 75 patients, so that has some limits as well. Our conclusions are that both groups had significant sustained weight loss up to 12 months. There was a significant weight loss difference at 3 months. However, there's no statistical significance at 6, 12, and 24 months, with both procedures causing significant weight loss. There's a trend of continued weight loss with duodenal switch up to 24 months. So for future research, we are continuing to do research on these. We are continuing to do these procedures on patients, so we would increase power, and we will increase continued follow-up, increase duration. What we can add in terms of investigation is complications from these procedures, as well as any resolution of comorbidities, which we did not focus on for the purposes of this study. We can also investigate different surgical techniques. We did not differentiate in the study between the SADI procedure and the BPD, and we did not measure Roux-en-Y gastric bypass like common channel length, and so that's something that we are looking into. We're also looking into certain weight loss medications to see if that would affect or augment any weight loss. Thank you very much. And I'm open for any questions.